Hey, quick one before we get into today's episode. If Damn Parenting Podcast has ever helped you figure anything out about life here in the Netherlands, maybe it's the birth story that made you feel less alone, an expert who finally explains something the Dutch system just never bothered to translate, well, I'd love you to just do one thing today. Share this episode with just one person. Just one. A new parent, a pregnant friend, someone in that WhatsApp group who's just been asking a lot of questions about the doctor lately and those vaccinations, because I promise you one thing. This episode can answer them. The show is free, it's every Wednesday, and it exists because people like you keep telling other people it exists. So share it, recommend it, or leave a 5-star review on Spotify or Apple. It makes a difference. Right, let's get into it. Welcome to Damn Parenting, the weekly podcast for international families navigating pregnancy, birth, and parenthood right here in the Netherlands. I'm Eva, your host, and today we are doing something I've wanted to do for a very long time because this is the topic that I think is the most asked about anything in any WhatsApp group there is going for pregnancy and for postpartum moms. It's vaccinations. And I think maybe we should have just a little bit of a backtrack on the vaccination scheme here in the Netherlands. So it actually set up in 1957, so it's running 68 years. It's about protecting children from serious diseases. It's completely free. It's completely organized, and it is completely different from any system that we grew up with in our home countries. So the program does change and it updates. In 2025 alone, there were 4 changes made, some moving some schedules up, some adding some on, like the RSV, which will be spoken about in a bit. So the system is comprehensive, it is evolving, and is probably quite different from what you were used to back home, which is exactly where the confusion comes in, because every single week, and I mean every single week without fail, I can see the same questions in all the immigrant parenting groups, the pregnancy groups, the new mom groups, even on Reddit, on Facebook groups, and even in my DMs at 11 o'clock at night. Things like, why isn't the chickenpox vaccination offered here? I mean, it is back home. I remember one woman was saying she missed a vaccination window and she was just wondering if she can never have that vaccination. I mean, there are a lot of different questions out there, and one of my personal favorites was, do I buy the medicine myself and bring it to the doctor? And I'm not making that up. People are confused. It is confusing. So I went back to the expert, and I could not be happier to welcome back someone who was one of the most listened to guests when she joined us for the Dutch healthcare system episode. You shared it or you messaged me about it, and I promise you this one is going to be just as useful. Dr. Marenne van Hengel Budde, welcome back to Damn Parenting.
Thank you. I'm happy to be online again, and I'm excited to talk about the Dutch National Vaccination Programme.
I have to ask, when I reached out to you to do this episode, you said yes immediately. So do you get these questions a lot?
I do, indeed. As I mentioned in the first episode when we talked to one another, I work at the youth healthcare in Amstelveen, close to Amsterdam, a region where we have a lot of people from abroad, expats, migrants from many different countries. And the vaccination program is always a topic that I talk about with the parents. And once they're from different countries, this always raises questions. So I think it's a very important topic to address and to hopefully clarify a bit for the listeners how it works and where people can seek help and information.
So can you give us a complete overview of the Dutch National Immunisation Programme? It's a huge ask, I know. So first off, who runs this?
Yes, so the Dutch National Immunisation Programme, we call it RVP, is funded by the Ministry of Health, Welfare and Sport. And in practice, it is publicly financed through general taxation, which means vaccines in the RVP are free of charge for participants. And the program itself is coordinated at a national level by the National Institute of Public Health, while the youth healthcare centers handles the invitations and administrations locally, and we also perform the vaccines. The youth healthcare services carry it out, and the appointments are scheduled by us, and they are planned on fixed moments according to the dates the RVP provides.
And can you also clarify here, how is it working in practice? Because you mentioned the RVP, you're talking about the youth health, and then obviously we all know our house arts. So how is this all working?
So the youth healthcare center in your municipality, they will invite you for an appointment as a youth healthcare physician. In the area where I work, I see many families from different nationalities, and therefore I also encounter a wide variety of national and international vaccine schedules. And then together with the parents, I review the vaccines a child has already received and which vaccines are still needed. And I think, as you mentioned, indeed, it's very valuable because it's an important topic for parents. And it often raises questions, especially when they're now living in a new country where the national program may differ from the vaccine program in their country of origin. So together, we'll look at the vaccine program, we'll see what is needed, and then we'll schedule further appointments according to the plan we make together with the parent. So it's good indeed to clarify that the GP in general is not involved with the national immunization program. We'll come to that later, I think, in this podcast. So if it's about private vaccines or additional vaccines apart from the national program, then the GP has an important role in organizing this. But for the national program, it's the RIVM and the Youth Healthcare Center that organize that.
Now is the big question. Can you actually walk us through the vaccine program that is currently in 2026, what each one is, and at what stage of a child's life it's given?
So the National Vaccination Program starts actually during pregnancy. So pregnant women are offered a maternal whooping cough vaccine to protect the newborns. And this vaccine is available from about 20 weeks of gestational age and beyond. There's another maternal flu vaccine that's offered only in the autumn season. So this will be September until March every year. And then we go to the vaccinations for the children. So we start with the RSV vaccine, and this is a vaccination to protect for airway infection that might be severe, especially in young infants. And same with the maternal flu, this is a seasonal vaccine. So the RSV vaccine will be offered to babies born in autumn, about 10 to 14 days after birth. And the babies that are born in spring and summer, they will be offered the vaccine in autumn, but they might be, depending when they're born, around 4 or 5 or 6 months of age. Then we start with rotavirus vaccine. So this is a virus that gives a lot of diarrhea and vomiting. It's a liquid, so it's a vaccine that we offer orally, and it's given to all babies around the 2nd and 3rd month of age. Now, then you probably, as a parent, see a lot of different letters and names about vaccines. So we have got a 6-valent vaccine. It's called the DKTP, hepatitis B and HIP vaccine. This includes diphtheria, that's a bacterial infection, tetanus, people might know about that, polio, influenza type B, it's an airway infection, hepatitis B, this is a lifelong protection if you have 3 doses in infancy. Then we add another pneumococcal vaccine. It's PCV in English. And these 2 vaccines, so this is 2 vaccines, will be offered at 3 months, 5 months, and 1 year of age. Then we have 2 vaccines offered after the 1st year. This is a measles, mumps, and rubella vaccine and a meningococcal ACWY vaccine. So this is for the first, let's say, 3 years. Then we have a redo of MMR at age 3. And then later on, we do have some repetition to give lifelong protection. And one vaccine that comes in later is the HPV vaccine to protect for cervical cancers, offered around age 10. I think in this podcast, it's too difficult to explain everything in detail. But if you want to know more, or you want to check in on details about vaccination, side effects, or what it's for, please feel happy to check the website of the RIVM. And you'll find a lot of information about the specific vaccinations. So to clarify, the National Vaccination Programme, it's free of charge. We'll handle the invitations, so you'll be noted when to come and when your next vaccine is due. That's, I think, important for parents to know.
And for the families arriving from abroad and their child might already have some vaccinations, but they're on a different schedule, do you have to restart? Does the Dutch system accept foreign vaccination records? How does that operate?
Yes, that's, I think, a very important question. Once this is on a daily basis, we meet people from abroad. So when families register in the Netherlands, they're automatically registered at the youth healthcare center nearby. And as I emphasized in the first episode, what's very helpful for the families and for us, if we get the contact details of the people after they arrive, so that this means an email address and phone number, so we can reach out and we can set up an appointment at the youth healthcare service. In this first visit, what we'll do, we'll always examine the foreign vaccination schedule. So us as physicians will zoom into the vaccination schedule from their country of birth, and we will compare it with the Dutch National Immunisation Programme. And then together we'll come to a plan to say, this is already given, we have to catch up with a few vaccines, or there are quite some differences between some countries, so we'll add on this and that vaccine. And I think it's good to emphasize that it's never the case that people have to start all over again, unless obviously they have not been vaccinated before, then it's a different story. But other than that, we'll always see the similarities and the differences and come to a plan together with the parents.
I think it's good to explain to parents a little bit about the exchange of information about the National Vaccine Programme. So as I mentioned, the youth healthcare services, we offer the vaccines and we register the vaccines. And with parental consent, we do share the information about the vaccines a child has received with the National Institution of Public Health, the RIVM. We do this to ensure that both organizations have accurate and up-to-date information, enabling them to invite children for future vaccines at the appropriate time. And it also serves as a quality control measure to help prevent errors, such as vaccines being administered at the wrong time. So I think it's good to emphasize to parents that this is a very common exchange and that it's very helpful for both us as the Youth Healthcare Center, as for the National Institution of Health to coordinate the vaccine program appropriately.
I just want to clarify one thing. There is something I hear a lot about in parent groups, and the idea is if you miss a vaccination window, it's too late and it's just never going to be done. But is that actually true? And what should a parent do if they have fallen behind on schedule?
If parents or children have missed a vaccination window, that's generally not a problem at all. It could be, of course, that their protection at that moment is not optimal, but as soon as they find out, they can seek contact with us, the youth healthcare professional, and they can visit the youth healthcare center. They can get the vaccinations at the first visit, and together we'll look at the schedule, we'll make a catch-up plan, and we'll schedule appointments for the next few months. And so it's never too late to revaccinate. There's only one exception. So RSV and rotavirus vaccines are offered at certain ages. And at some point, children might outgrow that age, and then these vaccines won't be able to be taken any longer.
And just moving on to a question about chickenpox, because this could be one of the single most common vaccination questions I've heard, because I remember having it myself many years ago. Many people are wondering, why don't they vaccinate against chickenpox here in the Netherlands? Because so many of the listeners here, chickenpox can be very standard for them, like Australia, Canada, Germany. The UK added it this year in January, but in the Netherlands, it's still not on schedule. Can you explain the thinking behind it, or what's the reason that you might be aware of that we're not?
Yes, I think it's a good question. I've been asked this question very often. So to answer, the chickenpox vaccine is currently indeed not part of the Dutch National Immunisation Programme. The main reason is that chickenpox is generally considered a mild childhood illness in healthy children, I must say, and most children recover without complications. The Health Council of the Netherlands and the RIVM have carefully evaluated whether a universal vaccination should be included in our program. And one important consideration is that the widespread vaccine could change the circulation of the virus in the population. And in this region, with a temperate climate, the Netherlands, more than 95% of the people, mainly the 12-year-old, have already had chickenpox, meaning they have immunity because they gained immunity by having had the chickenpox disease in their youth. And if fewer young children become infected naturally, then the disease may occur more often at an older age, and then the chickenpox may be more severe or cause more complications. And maybe to give you a little bit of detail from the Dutch statistics, the average annual incidence of hospital admission due to the chickenpox infection as a primary diagnosis was 1 to 2 per 100,000 inhabitants in the period of 2019-2021. So of course, if your child suffers in this matter, it's very unfortunate, but overall, the incidence of severe complications is very low. And all those things together make the RIVM decide not to include it. Another add-on is that the possible effect on shingles, so this is the herpes zoster at an older age, might also change if there is an introduction of the chickenpox vaccine. So that's another consideration they've taken into account.
So for any parent out there who wants to get their child vaccinated against the chickenpox privately, is there a minimum age or a maximum age?
Yeah, so the chickenpox vaccine is available from 1 year onwards, and parents can see either the GP to ask for the vaccination, or they can attend to a travel clinic to ask for this vaccine as a private vaccination. The chickenpox vaccine, I must say, is highly effective. So 2 doses prevent more than 92 to 95% of all chickenpox cases, and for sure they'll protect against a severe infection. The vaccines also reduce the risk of transmission. I think normally people will develop immunity after about 2 to 4 weeks after vaccination. So what I sense is that many parents get a little bit more concerned about their child not having had the chickenpox disease once they attend primary school, because it often goes round at an early age in the daycare, and maybe in primary school it's less common to be infected. So then they raised the question, should I organize the vaccination against chickenpox for my child? The guideline says children older than 12 years of age, they are offered the vaccine because they're in a risk group, because they're at an older age. And if parents decide to do it between 4 years and 12 years on their own initiative, of course, this is fine. And it's always an option to organize that. But the GP might see the guideline and say, actually, your child is not yet 12, so strictly it's not the risk group. Maybe to add on, there's 2 other risk groups. And this is 1, women that plan a pregnancy and never suffered chickenpox disease. So those women, I would advise, please, before you plan a pregnancy, get yourself vaccinated. That's very important. And the other one is that there's obviously people with severe immune disorders. So they will be indicated by their specialists when they're more vulnerable to have the vaccination on a medical basis.
Can I just ask there, you said the guideline says the age of 12. Why 12? What makes 12 a magic number?
Yes, I think 12 in that sense is the magic number, because they know that at an older age, the complaints might be more severe and complications might be more common. So I think this is just a cutoff. You go to secondary school, you're sort of growing into adulthood, and then more chance for complications.
And if we do want to go and get this, as you say, between the ages of maybe 1 and 12, and we want to do it on our own, can you explain to us, where do we go? How much does it cost? How many doses?
Yes, for private chickenpox vaccine, there are actually 2 options. It needs 2 doses, and it's about €90 per dose. You can either see your GP and ask for a prescription for the varicella vaccination, and then you pick it up at the pharmacy with the prescription, and the GP will offer the vaccination. After a month or 6 weeks, you go again for the second dose, or you plan a visit at a travel clinic. Clinics are spread throughout the whole country, and then you request the varicella vaccine, and at those centers they have it directly available, and they will directly give the vaccine, and they reschedule another visit for the second dose. It's good to note, though, that the travel clinics often ask a consultation fee extra. So they ask a consultation fee plus the price for the vaccine, whereas the GP gives you the prescription, you pay for the vaccine, but the consultation is free.
Let's talk about something that I think genuinely surprises some of the listeners, particularly those from outside Europe, because some families receive a letter from the GGD offering their baby an extra vaccination against tuberculosis, the BCG vaccination. And for many parents who've never heard of this, that letter can, well, feel quite alarming. Can you actually explain what it is and why some babies receive it?
Yes. So in the Netherlands, not everyone routinely receives a BCG vaccination against tuberculosis. This is offered selectively to risk groups, and this is particularly young children, of whom at least one parent comes from a country where TB, tuberculosis, is common. There is a TB country list, to say so. So online you can find Landenlijst TB, and at that list you'll see all the countries that have higher risk for TB, and that would be defined as more than 50 TB cases per 100,000 people in the population. Most of these countries are Asian countries, some Southeast Asian countries, Latin America, and quite many sub-Saharan African countries. So families usually find out about eligibility for the BCG vaccine through the youth healthcare center or their midwife or sometimes the GP. And during the first contact with the family, the healthcare professional will ask the parents about their countries of origin and possible tuberculosis risk factors. Now, then to answer your question, who is eligible for the TB vaccine? Children up to 12 years of age with one or both parents originating from a high-risk TB country. These children will usually receive an invitation from the GGD around the age of 3 months. So this is an automatic process. They will be invited and they will be provided the TB vaccine. Of course, it's a voluntary vaccination. So if people might say, or parents might say, we won't go back to our home country, we'll stay here indefinite and we do not need the TB vaccine, of course, they're not obliged to take it. The vaccine does not provide 100% protection, but it does protect against the most severe forms of tuberculosis. So I think that accounts for the children that are born here. Of course, there is also another risk group, and this could be people that have close contact with TB patients or travelers or immigrants who will stay for a prolonged period in a high-risk country. Then these people may receive a vaccination based on a medical indication. I think what's also good to mention, so as I explained before, this accounts for the children that are born in the Netherlands. Of course, there's also a lot of people that come from abroad with children at an older age. Either they received the BCG vaccine already in their home country. If not, they will also be invited. But people that originate from a country where the TB risk is higher will be seen by GGD tuberculosis department to often do a skin test to see whether they're protected or they show immunity. So this accounts mainly for adults that come from abroad. They will always be invited to be checked whether they're protected properly.
Okay, and what does the BCG vaccination actually involve? I mean, is this one painful? Does it leave a scar? What should a parent expect afterwards?
Yes, so the TB vaccination is given in the upper arm routinely. It often leaves a skin reaction that can be a bit of redness. It can also be a small abscess that appears 4 to 8 weeks later, and it may last quite long, up to 6 months. This is a normal symptom and it's not a sign of infection. A scar is to be expected though. And I think that parents will receive an information leaflet explaining some information about the possible skin reactions that may occur. They can find the information there and they can contact the clinic who provided the vaccine or the youth healthcare center or their GP if they have questions or they worry about the scar or the abscess. It's good to clarify, I think, in general, it's advised not to interfere with the wound because often it's a normal reaction of the skin.
And beyond chickenpox, our listeners often ask about various vaccinations that are quite standard in their home countries but are not here. Can we cover some of the most common vaccinations that these parents might ask you, but they're not actually part of this Dutch program?
Yes, there are quite some vaccinations that parents ask about. I would say 3 of the most common vaccines that they ask about is the meningitis B vaccine, the influenza flu vaccine, and the hepatitis A vaccine. As I said, so worldwide, there's a lot of similarity in the national vaccination program. But for example, meningitis prevention may differ per country, and then specifically which type of meningitis. So there's meningitis type B, there's meningitis type ACWY. There's also, for example, the Japanese encephalitis, the GE variation. Obviously, there are a lot more variations possible, but many countries, they offer meningitis B vaccine. This is not part of our national program. People can request the meningitis B vaccine. Generally, this goes through the GP. So if you seek a consultation with your GP and you request that you want your child to be vaccinated for meningococcal B vaccine, then normally the GP orders the vaccine at the pharmacy. You pick up the vaccine yourself, you bring it back to the GP, and they can perform the vaccination. Depending on the age of the baby, this is often a 2 to 3 dose. Depends also a bit on the schedule. It's quite pricey. So the total cost for the full series would be between 240 to 360 euro. So it's, I would say it's quite expensive. The Dutch National Healthcare Program includes meningitis ACWY, which is offered at the age of 14 months and 14 years. Regarding hepatitis A, this is a very common vaccine in a lot of countries. I would say, it's part of the national program for many children, for example, in United States, in South Korea, in Israel, in many countries in Southeast Asia. China is one of them. And it's a very common vaccine for travelers. So also European people that go to a country with a higher risk for hepatitis A, they'll go to a travel clinic and get the vaccines. If you have 2 vaccines in total, you generally have a protection for about 30, 40. They also say maybe lifelong protection. And then you'll look at a total cost of about 160 to 180. I think it's about 80 to 90 euros per dose. So I would say these 3 vaccines, I think I get most questions about.
And you mentioned there that you can have it at the house arts or you can go to a pharmacy. Do you go to a pharmacy and just ask for it, or do you need a prescription to get them?
No, you cannot go to the pharmacy to ask for it. So the GP can prescribe the prescriptions and he'll send that to the pharmacy and there you'll pick it up, but you need indeed the prescription. Regarding a travel clinic, they organize and handle all the vaccines. So you explain them which vaccines you prefer to get and they organize that and then you pay for it.
And many of the listeners who are international tend to obviously fly back home to visit their families. If a family is planning to travel with a baby or a young child, how far in advance should they start thinking about travel vaccinations? And again, where are they meant to go?
Yes, good question. So if you're traveling with your family and you need vaccinations for your trip, it's best to visit a travel vaccination clinic, because these clinics, they specialize in travel medicine and they have expertise in the diseases that are endemic in the countries you plan to visit. They can provide you with appropriate advice and for a fee administer the required vaccines on the spot. I think most vaccines need about 2 to 4 weeks to become fully effective. And once some vaccines need a second dose, often with about a 4-week interval, I would say find your clinic about 1 to 2 months prior to departure, or at least inquire what's needed, and then schedule a visit.
Before we wrap things up, there are a few more things that have come in from listeners and people I've spoken to in the last few weeks, and I just want to make sure we cover them here. For a healthy child with no underlying conditions, is there any reason a parent in the Netherlands might want to consider a flu vaccine, or are they just generally only for risk groups here?
So indeed, the flu vaccine is only for risk groups in the Netherlands. It's not included in the National Immunisation Programme, but of course, upon request, you can take it privately, as it's quite common in different countries, whereas the US, the UK, and Australia. The flu vaccine is generally considered safe and effective from 6 months of age onwards. And small children between 6 months and 8 years, they receive the flu vaccine. In the first season, they need 2 doses. But this is, as I say, not a common vaccine. It's a personal request that you can obtain through your GP or the travel clinic.
And in your own experience working with international families, what do you think is the thing parents worry about most when it comes to vaccinations here in the Netherlands that you actually find they really don't need to worry about at all?
So what I come across as a youth healthcare professional, the most questions and the worries that parents have is about missing a vaccination window. And I think they should not worry about that because we can always catch up and overall we'll schedule the appointments and this will be fine.
One practical thing I want to make sure we mention, if a parent actually wants to check what vaccinations their child has received here in the Dutch system, is there a place that they can go online to see that?
Yes, there is. And I think it's very helpful for parents who lost the paperwork or might have got lost in their vaccination program of their child. So if you want to view it online, you can log in using your DigiD and you can either use the parental portal, that's the online environment of the GJZ, or you can use the online portal of My RIVM. You can review it online, or you can request them to send you a copy either by email or by post. And in the show notes of this podcast, we'll share the website and the email address that you can use. That will be helpful, I think.
Okay, thank you so much to Dr. Marenne van Hengel Budde for an absolutely expansive episode on all things vaccination. We did try to get through as many questions as we possibly could, and I just want to say all those questions do come from 2 different places. The first was the research I did through all the WhatsApp parenting groups, the Reddit threads, the Facebook posts, and the things that even people type into Google at midnight when they just realize, should they be getting the chickenpox for their kid yet? The second place was actually from questions from you. I did ask for questions over the last few weeks and you did deliver. So if your question was answered today, I hope it helped. And if it didn't, well, message us, because Dr. Marenne has very generously indicated she may come back, and I already have a list of more questions. Now, all the links, websites, and resources we mentioned in this episode are in the show notes, and that includes the RIVM website, the KNCV TB country list, and the Mijn RIVM.nl portal, where you can check your child's vaccination record, and the GGD contact details for both the BCJ and the travel vaccination services. Everything is there, and I'm sure it's going to be enough. And if you are more a visual person, or you just want something you can save and come back to, head on over to Instagram. We're at Damn Parenting Podcast, and we have 2 carousels from this episode going to be coming out to you this week. One's covering the full Dutch vaccination schedule by age, and the other one walks you through exactly how to check your child's vaccination record online in under 2 minutes. So make sure you go and save them because they're worth having. As always, if today's episode helped you, share it with one person. That's all it takes to grow this community and make sure more international parents right here in the Netherlands find this show. New episodes come out every Wednesday. The show notes and all previous episodes are online on Spotify, on Apple Podcasts, YouTube, wherever you get your podcast from. Make sure you search Damn Parenting wherever you listen. I'll see you next Wednesday. And always remember, you're not alone.